Dear students, Assalamu alaikum. I am Dr. Tarafder Shahniam Ahmed, Associate Professor of Department of Pharmacology, Bashundhara Ad-din Medical College, South Keraniganj, Dhaka. Hope you are all fine by the grace of Almighty Allah. Today, I will take a lecture class on drugs acting on the autonomic nervous system. So, let us start. What is the specific learning objective of this class? At the end of this class, you should learn to explain the terms and definitions related to autonomic nervous system, and you should be able to classify the drugs that affect this autonomic nervous system and explain different agonists and antagonists acting on autonomic nervous system. You should also be able to identify the pharmacological effects, interpret the actions and kinetics and toxicity of these drugs, and you should be able to correlate these knowledge to form the basis for rational use of drugs in a given clinical situation. Let us recapitulate some previous knowledge you have already learned in first and second year in the subject of anatomy and physiology regarding the autonomic nervous system. What is the definition of neurotransmitters? Neurotransmitters are the substances released from the nerve terminals into the synaptic cleft, which then activate or inhibit postsynaptic neuron or effector organs by binding to specialized receptors. So, I have already told you the definition of neurotransmitter. Then what is neurochemical transmission? Neurochemical transmission is the transmission of nerve impulse across the synapse located between neurons or at neuroeffector junction, for example neuromuscular junction or neuroneuronal junction in the ganglia. All right. Then let us also recapitulate the fundamental steps of neurotransmission. The first step is synthesis of neurotransmitter from its precursor amino acids. Then the second step is storage of these already synthesized neurotransmitters within the presynaptic vesicles. The third step is release of these transmitter by nerve action potential with the help of influx of calcium ion through calcium channel. And the fourth step is interaction of these neurotransmitters, released neurotransmitters with the postsynaptic or second order neurons. There are receptors within the postsynaptic membrane. These release neurotransmitter attached with these receptors and produce a response which might be two types, either excitatory postsynaptic potential or inhibitory postsynaptic potential. The fifth step is rapid removal of the neurotransmitter by degradation or metabolism or uptake or reuptake 1 and reuptake 2. And finally, the sixth step is recovery of the effector cell into the previous state. So, these are the six fundamental steps of neurotransmission, and in the video now you can see a slide showing the figure which can be obtained from your textbook, and this figure clearly demonstrates the fundamental steps of neurotransmission, and you should revise it, study it thoroughly, and you need to memorize these steps, because in further lecture or further slides you have to apply these steps when we will discuss the drugs acting on this nervous system, autonomic nervous system. The next slide shows the classification or division of nervous system, and these are very basic concepts that you already know. Then our nervous system is divided into central and peripheral nervous system, and peripheral nervous system is again divided into autonomic, somatic and enteric nervous system, and autonomic nervous system is further classified into sympathetic and parasympathetic nervous system. What is the basic difference between somatic and autonomic nervous system? Somatic nervous system is voluntary movement. As you can see that I am moving my hands and giving you lecture and speaking, all these things are voluntary and is controlled by somatic nervous system, direct motor innervation to my skeletal muscle from the brain. And what is peripheral nervous system? The peripheral nervous system is controlled by autonomic ganglia, and the first order neuron synapses in my spinal cord, and from there the second order neuron arises and controls our involuntary organs or viscera within our body. So, these are the two basic steps of somatic and autonomic nervous system. And the next slide is showing you about the role of enteric nervous system and the neurotransmitters that work there. The enteric nervous system contains the neurotransmitters such as serotonin, substance P, vasoactive intestinal peptide and calcitonin, gene related peptide. What is the function of this nervous system? It controls the motility or peristaltic movement, and all the intestinal secretions is regulated by this nervous system, and it is involuntary actually. Now, the next slide shows you the difference between sympathetic and parasympathetic nervous system. We say that sympathetic nervous system is in control of fight or flight, right? When you are fighting or you are in a flight, our sympathetic nervous system comes into actions, right? Our heart rate increases, blood pressure increases, pupils are dilated, we are in adrenal rush and feel fear or anger, these sorts of emotions. And what about the parasympathetic nervous system? It slows down our heart, slows down our respiration, and our body experiences a episode of rest and digest. All right. So, these are the very basic concepts about autonomic, somatic nervous system, about sympathetic and parasympathetic nervous system. These are actually recapitulation of your previous knowledge. These are required to further progress to our pharmacological discussions. These are not part of pharmacology. All right. Now, if we again discuss what are the neurotransmitters of autonomic nervous system, the first name you should be able to utter is acetylcholine. Acetylcholine is the major neurotransmitter of this nervous system, and then the other neurotransmitters are norepinephrine or noradrenaline, epinephrine or adrenaline. Here you should mind that these terminologies, norepinephrine and noradrenaline, is the same thing. Norepinephrine is American and noradrenaline is British. Similarly, epinephrine is American and adrenaline is British. The other neurotransmitters are dopamine, nitric oxide, serotonin, gastrin releasing peptide or GRP, and vasoactive intestinal peptide or VIP. The next slide shows you the very beautiful figure explaining the distribution of autonomic nervous system, the autonomic nerve fibers, the preganglionic and postganglionic cholinergic fibers, and very few postganglionic nerve fibers that secrete norepinephrine, dopamine. Okay. The figure explains the distribution of cholinergic and adrenergic nerve fibers. Please note the figure. Where are the acetylcholinergic or cholinergic nerve fibers are distributed? All preganglionic, sympathetic and parasympathetic nerve terminals, all preganglionic nerve terminals. Then parasympathetic postganglionic nerve terminals colored in blue. Please note that all the cholinergic nerve fibers are colored in blue. And somatic neuromuscular junctions, secretory cells of the smooth muscles of the enteric nervous system, and some postganglionic fibers of the sympathetic such as the sweat glands. And please note that the dopaminergic nerve terminal or nerve fiber is colored in green. The adrenergic or norepinephrine nerve fiber is colored in red, and there you can see in the lower portion that the adrenal medulla secretes epinephrine and norepinephrine, but it is innervated by acetylcholine. So, please study this figure and we will discuss the further details about sympathetic nervous system. So, we have discussed the preliminary prerequisites about your autonomic nervous systems, and in next class we should progress further about the sympathetic nervous system and drugs acting on the sympathetic nervous system. There will be actually two groups of drugs, that are sympathomimetic drugs and sympatholytic drugs. Sympathomimetic drug means the drugs which actually occupy these sympathetic receptors and produce a response. These are agonists, and the sympatholytic drugs means the drugs which occupy these receptors or block these receptors, but does not produce any response. So, till next class, have a good day. Thank you all. Assalamu alaikum wa rahmatullahi wa barakatuh.